Hello, hello. It's Dr. Langford. I am a practicing urologist with over 25 years of experience, and I am going to tell you the secret battle plan to prevent UTIs. So, first of all, let's talk about what a UTI is. It is a bacterial infection of the bladder, urethra, or kidneys in a woman. Specifically today, I wanted to talk about women that are over 40, perimenopausal or postmenopausal, that are getting recurrent urinary tract infections. This is more common again because the hormonal changes that occur in perimenopausal or postmenopausal women put them at risk for urinary tract infections. It changes the pH, it changes the tissue and lubrication of the urethra and the bladder, the vaginal area. And so that can change the little environment or micro environment that causes urinary tract infections to be more common. What I'm specifically talking about is bacteria that gets into the urinary tract, usually climbing backwards through the urethra into the bladder and causing symptomatic issues. For older ladies, again, the symptoms can be different, but the common one I see is that they get urgency and frequency or leakage. So if you're a woman that started to leak and you didn't leak before, this might be the first sign of a UTI. So the risk factors could be just being a perimenopausal or postmenopausal woman, dehydration, not flushing the urinary tract out the way it should. Being sexually active can obviously contribute to it. And it's not so much, again, a hygiene issue. It's just a matter of when you're sexually active, you're stirring around those bacteria and moving bacteria from the vaginal area towards the urethra and causing it to be exposed to more bacteria that can cause an issue for you. There are very specific health conditions that can cause you to get more urinary tract infections than other people. The one that stands out the most to me is diabetes. Your body is more prone to infections in general when you have diabetes, and you are more likely to get um, sugar in your urine. That's how your body excretes some of the excess blood sugar. It goes through the kidneys and out through the urine. And so bacteria loves sugar. So when your urine is on the sweeter side, or there's actually more sugar in the urine, bacteria really enjoy living in that warm environment, and they tend to cause more urinary tract infections. So let's start with step one of the battle plan. It is the simplest of all. Just hydrate. Hydration is the key. You need to drink 8-ounce glasses of water a day, at least, to stay hydrated to the point that your urinary tract is kind of flushed and letting some of this bacteria flush through rather than hold on and cause an infection. When you are dehydrated, this bacteria gets more concentrated and it can actually be more symptomatic for urinary tract infections. So, flushing it through is the way to go. I tell everybody that when your urine is very pale yellow, you're more well hydrated. If you can read through it, it's a sign that you're very well hydrated. And I think you need to think about your urinary tract like a river instead of a pond. A pond has more bacteria and things in it, and the same is true for your urinary tract. You want it to be flowing like a river and not stagnant like a pond. So step two of the battle plan is hygiene habits. Now, I did say that most of my patients that have recurrent UTIs, it's not related to hygiene. Most people are not causing themselves to get UTIs, but it is important to understand that the urethra is very close to the rectum and the anus in women and right at the vaginal opening. So when you have real estate that's that close together, it's very easy for bacteria to get back and forth. So if you are having some gastrointestinal issues or diarrhea, it's very important to kind of make sure that you're wiping front to back always, making sure that you urinate after intercourse is a good habit to be uh, familiar with, just because it helps to flush things through. One thing I really think is important is making sure that you really watch the type of feminine products you use. Very, very harsh chemicals are in a lot of soaps nowadays, and it's really important to keep good bacterial and pH balance in the vaginal area. In the vagina, it's a little ecosystem. It's got good and bad bacteria, and when you throw that ecosystem off with pH, you end up causing yourself to be more prone to a UTI. So we really want to make sure that you're doing the best you can to to balance the pH. So if you're using feminine products, please make sure you use pH balanced products. Make sure you use them with as few dyes and harsh chemicals as possible. And I think when you're over cleansing the area, sometimes you're not doing yourself any favors. The vaginal urethral area is kind of like a self-cleaning oven. You don't really need to keep doing things over and over and over again. Just use, soap and water in a shower and some simple things. You do not need to douche. That is not a great habit to get into. And I think that it's just important to keep in mind that it's an ecosystem that you want to keep in balance. Remember that small hygiene changes can make a big difference in whether or not you are keeping this bacteria at bay. So let's talk about step number three to the battle plan, and that is diet and supplements. We want to make sure that you are, even if you're not diabetic, avoiding high sugar diets. They're terrible for your body. Sugar is generally poison for the body, even if you're not diabetic. And if you can avoid a high sugar diet, it's going to help you to prevent urinary tract infections. I really think that there are a few supplements that are very helpful in this arena. All of you have heard about cranberry juice, but really you don't want to have cranberry juice. That's very high in sugar, and you'd have to drink a few gallons of it to get the equivalent of what you can with cranberry pills. I like cranberry pills. I like Utiva. And there's a number of cranberry pills that you can get on the market that don't have to be brand name, and they contain in them PACs, which are things that help the bacteria to release and not hold on to cause an infection. It's never going to hurt you to be on cranberry pills. There's only a few instances where I'd say it's a bad idea. Specifically, people who have really um, irritated, painful bladders. I try and keep them off cranberry pills, but generally speaking, it's good for almost everybody. And it's a really good natural way to prevent infections. Another option is probiotics. I'm a big fan of probiotics. Your gut needs to be healthy for you to do well in general, but when your gut is healthy and you can be on probiotics that are specifically designed for women that have the lactobacillus and acidophilus in it, I really think that that helps you to balance out the good bacteria so that when you're having this little ecosystem battle, that your good bacteria is as strong as your bad bacteria. This keeps you in balance and prevents you from getting a UTI. Um, the other thing I think is really helpful is vitamin C. These are all very inexpensive supplements that you can use on a daily basis, and they're only going to help you with your health otherwise. Vitamin C helps to boost immunity in general. Acidifies urine, and it helps to defer bacteria from sticking to the lining of the bladder and the urinary tract. So it's a really helpful thing to throw into the mix and can sometimes be used with actually prescription medications to help prevent urinary tract infections. Um, I think that another thing that's really been a game changer in my practice is something called Eucora. Eucora is what's advertised on TV, and it's a system of probiotics, prebiotics. It's got a flush. It contains something called D-Mannose. It has some vitamin C. So it kind of combines all of the supplemental things that are useful to prevent a UTI. What I like so much about it is it's a daily product that you can use almost like a vitamin for the bladder that creates an environment that's less hospitable to bacteria. And then it also contains a drink that's almost like a crystal light. And you put in the drink to your water, I'm sorry, the little powder into your water, and it ends up causing you to clear an infection that might be just starting to hold on. So it's a really natural way to keep off antibiotics. Antibiotics cause a lot of issues. They can stop bacteria, but they also mess up your gut bacteria, and they can cause imbalances in the vaginal bacteria. That's why when you're on an antibiotic, you might get a yeast infection because all these little bacteria live in the vaginal area, and they're right near the urethra, which causes that's where the urethra can get the bacteria to cause an infection. And when your good and bad bacteria are balanced and everything's in good shape, you don't have a yeast infection. But when you go on an antibiotic and you clear out some of the bacteria, you end up getting an overgrowth of things that are already there and cause that to be a big issue as well. So balance is the key. I cannot tell you enough how much environment, balance, and pH is important to this process. The biggest thing that I think is a game changer for urinary tract infections is urethral estradiol cream. Now, estradiol got a really bad rap in 2002 with the Women's Health Initiative, and you may all know that this has changed since that time to really be understood much more thoroughly and to really see the value in women's health. When you are a woman that is cut off from estrogen suddenly with menopause or surgical menopause, you are thrown into a situation where you are absolutely more prone to urinary tract infections. And I would say one third to two-thirds of my patients that are able to stop the urinary tract infection cycle use urethral estradiol cream. Now, there's a number of different ways to do that. You can use a commercially available estradiol. You can get a compounded estradiol. You can use estriol, which is a lighter version of it. And I would venture to say that even oncologists are coming around for women that have had estrogen sensitive breast cancer, that some of these women are able to actually use estrogen products as well. So you really clearly need to speak to your doctor about what's right for you, because there are specific situations where estrogen may not be the best option. But in my practice, in a woman that has no reason that they can't use estrogen, what I do is I have them take a tiny little pea size of estrogen cream. They put it on their finger. They put it right where they urinate from, right at the urethra. They place it there once a night for 2 weeks, then Monday, Wednesday, Friday thereafter. And if they're postmenopausal, they're not getting any closer to estrogen. So this is a lifetime scenario. It balances the pH. It helps the tissue to get thicker and healthier. I cannot tell you how important that has been as a game changer in my practice, in addition to Eucora and estradiol and the hydration, vitamin C, some of the other things I mentioned. It really can move the needle as far as preventing urinary tract infections. So if you are a patient that can use estrogen, I encourage you to talk to your primary care physician, your urologist, your gynecologist, whoever you deal with that might be able to help you with estradiol cream, and see if you can use the tiniest little bit. Now, it is FDA approved to use 2 grams a week, which is a huge amount. I have my patients not even use 1 gram probably over a month because they're just using a pea size on their finger. So keep it in perspective that this is a very tiny amount of cream and it can offer you a huge benefit. What I do is I have them take a tiny little pea size of estrogen cream. They put it on their finger. They put it right where they urinate from, right at the urethra. They place it there once a night for 2 weeks, then Monday, Wednesday, Friday thereafter. And if they're postmenopausal, they're not getting any closer to estrogen. So this is a lifetime scenario. I tell them to think about it like moisturizer on your face. You would never just stop using moisturizer. So I don't want you to ever just stop using estrogen if that's what you need at the urethra. It balances the pH. It helps the tissue to get thicker and healthier. The mucous membranes actually put out more of a balanced a lubrication that is actually helpful to prevent urinary tract infections. So I cannot tell you how important that has been as a game changer in my practice, in addition to Eucora and estradiol and the hydration, vitamin C, some of the other things I mentioned. It really can move the needle as far as preventing urinary tract infections. So if you are a patient that can use estrogen, I encourage you to talk to your primary care physician, your urologist, your gynecologist, whoever you deal with that might be able to help you with estradiol cream, and see if you can use the tiniest little bit. Now, it is FDA approved to use 2 grams a week, which is a huge amount. I have my patients not even use 1 gram probably over a month because they're just using a pea size on their finger. So keep it in perspective that this is a very tiny amount of cream and it can offer you a huge benefit. I think it's important just to make sure that you don't suffer in silence with these things. So let's go over your battle plan again. First, you want to stay hydrated. Whatever that hydration means to you, make sure you do it. You need your urine to look pale yellow and clear, and if it does not, you're probably not hydrated enough. Practice good hygiene. Make sure you wipe front to back, urinate after intercourse, and make sure that you're not, sitting in wet bathing suits, some obvious things. Don't sit in wet pads if you have leakage. And then about supplements, make sure you're using something like a cranberry pill. Use a probiotic. Consider a system like Eucora, which incorporates all of these different things. Add vitamin C. Consider D-Mannose, which is another supplement that can help you to prevent urinary tract infections. Make sure that you are urinating regularly. Don't hold your urine. And make sure that if you are a candidate to use estradiol cream, get on it. It is a game changer for urinary tract infections and can really help you to do well. It will change the way your body responds if you do it for at least 6 weeks in the way I just discussed. So talk to your doctor about that. And then make sure that you seek professional help if you have persistent infections, if you see gross blood in the urine, if you're just not getting the treatment resolution of your symptoms with the treatment you're receiving, make sure you follow up with a urologist. It could be something more important and you need to know. So let's try and take control of your health together. Hit subscribe and share.